on that point, whether it's digitization or the better use of data, when you talk about personalization, I mean, where are we on that curve today, and where could the inflection point be in actually being able to deliver personalized services?
We're very, very, very early in the stage. So, I mean, even today...
And will it really be affordable anytime soon?
Again, it'll have to get covered by financing, right? I mean, for example, it's happening in the US, it's happening in the Western world. Genetic testing is covered in significant cases by insurance companies. I mean, we are obviously still 25 years behind, where insurance is not even covering a basic test when you go to a doctor, right? So we're still early in it. Like today, we've got tests that, you know, for example, for TB or for HIV or hepatitis, we can tell you your genetic makeup. We can tell you what drug will work well on you and what drug will not work well on you. But doctors are not able to use it today because of the lack of affordability and lack of education. So I think we will certainly progress on this evolution. But I would certainly say that, you know, 10 years later, 15 years later, I think and I hope healthcare will look far more integrated for the patient, where data is integrated, care is integrated, people are talking to each other, and it's not all these little pieces. The second thing I think which is going to be very critical, your question around diagnostics. You know, we've seen ridiculous amounts of noise in this industry in the last few years, right? We've seen everyday news articles about this one entering, that one entering, and it almost became a joke.
Tests for free virtually.
I mean, it became a joke, right? Where as if we were talking about something which is not healthcare. I mean, fundamentally, what are we doing in diagnostics? You're taking your best quality doctors, your best equipments, your best processes, and you're giving somebody a picture of what's happening in their body. If that's not correct, your treatment is going to go wrong. And it's been so commoditized in the newspapers, like anybody can do a test, which is totally not true. So I think we are seeing a normalization of this, where people are recognizing, and honestly, doctors and hospitals always knew the reality. It's only consumers who didn't understand healthcare were very taken away by the noise. We're seeing a normalization. So the
capital, the VC funding has been the problem there, not the solution, not the answer?
It's not only the funding, right, but it's also this desire to consumerize healthcare without substantive knowledge. You cannot consumerize an industry you don't understand, right, because the science behind it is the core. So consumerization is great from a perspective of make life easier for patients, make it more convenient, but you can't skip over the substance, which is what unfortunately happened in the last few years, and which I think will continue. And the main reason behind this is because there's a complete lack of regulatory environment for diagnostics. We have 300,000 labs in India, of which 99.99% are not accredited, right? So that means any individual walking in today to a lab, you may get a report, you don't know what you're seeing. It's a really scary situation.
No, it is a scary situation. So you're saying that a majority of the diagnostic centers are not accredited either by the NABL or whatever else.
99.9%.
99.9%. That does, as a consumer, that does worry me. That does make me concerned about where I'm getting my tests done or where the information is coming to me from. But let's address this from the healthcare sector's perspective as well. And let me get Dr. Tarang into the conversation. You know, to the point that Amira was making about while you want personalization, you don't want commoditization of patient care. As a healthcare service provider today, how are you looking at the changes that are taking place, and how are you shaping your strategy, your policies in line with that?
The healthcare 10 years down the line will have to make healthcare accessible to the patients and also much advanced than what we are today in all three aspects. The reason why I say so is because that's the demand of your consumer. So your consumer is actually a patient or actually a normal human being like us. We are moving towards an idea of trying to be preventive rather than, as Umang really rightly said, and it's not only for the medicines, in all aspects. The healthcare 10 years down the line will be only focusing, or not, it will be, I would say 60% the focus of people will be on prevention, then only cure. And when we say prevention, it's not like I should not get the disease. The prevention means, okay, I have hypertension, but I do not want to get stroke, making a point to what Sanjeev said. So I think everybody will be looking at that. So when we drive our strategies towards the fact that, okay, when we are looking at healthcare, how do we get the accessibility to the patient? Yeah. The strategies basically is integrated, use the technology. Technology on our side, as Amira said, is people will need more of personalized medicine. So when we say personalized medicine, is that use AI, use technology to ensure that the data that you get from the patient, how to improve the patient outcomes using the data. One of the thing is that you use technology to make the healthcare accessible, personalized and predictive also.
While there's a lot of enthusiasm about private equity getting into the hospital sector, but what does it actually mean as far as patient care is concerned? Are we going to see patient care, the costs of that go up significantly? Because at the end of the day, private equity wants return on capital, and that's just how they operate. So what is it going to mean, not just for the sector, but also for the patient? Govind.
Let me start by, before I answer your question, let me talk about what Umang raised first, and then Tarang and Sanjeev, and everybody's talked about it. You know, you talked about a little bit about the future. So till now, the hospitals have been sick care, because we treat sick patients. But we've talked about preventive. Essentially what is happening is we are moving to a wellness care. So people will take care of for example, hospitals like us, instead of becoming sick care hospitals, will become health care. So we take care of healthcare of the community, take care of healthcare of the patients, previous and so on. So for that, what it means is that you need to have the data to collect that. You need to have little predictive analytics and so on. And also one more thing is the care which we are providing in the hospital today is probably going to move out of the hospital, and we have seen this going out for care at home services. Also, we may not realize that India has a large elderly population and it's going to grow. So after a few years,
even though we keep talking about only our demographic dividend, yes.
So the elder population is expected to be around 19% by 2050, and of maybe 1.5 billion, it's a huge number. So that means those people will need some kind of a care at home. There will be other services outside the hospital, and where PE will come in. I'm going to come in for a minute. And then what is happening is the new trend of the digital. Everyone talks digital. So the journey of digital has been that till now we have focused on giving convenience to the patient, better logistics, better ease of working. But now what is going to happen is it's going to move to a place where we are going to do digital health delivery. So that means we collect the data, and we're already seeing variables, we're already seeing monitoring the vitals, and then trying to deliver some health through digital means. Example is telemedicine is a very simple example of that. E-monitoring of ICUs is an example of that. Now when you do all that, there is what you need in a country like India, and Tarang, I mentioned that, is the access to the tier 2, tier 3. So the Niti Aayog said that around 50% of the people have, or sorry, the other way around, 1/3 people have more than 50% of healthcare in the country. So to provide access, what we need is the ability to pay, not affordability. Because everybody keeps talking about affordability. I mean, we talked about CAR-T. CAR-T is not going to be affordable unless somebody has the ability to pay. Right. So what we are talking about as the insurance at the top end, many private sectors are there. We have Ayushman at the lower end. What we need is a middle class insurance Ayushman type of a scheme that will take care of the affordability. And then we come to private equity. The reason why private equity wants is what you mentioned earlier about returns and so on. But I think the biggest advantage of private equity is that because they want good returns, they will help you get quick scale up and quick access. The access to India will come because of private equity driving, because healthcare is a very capital intensive business. If you are getting capital which is helping you drive, I think private equity has a good role to play. However, I just need to caution, healthcare cannot be devoid of good clinical outcomes. So if you are saying that I am getting private equity only to scale up and make money, it will not work unless backed by good clinical outcomes.
But let's talk about future opportunities, and I think the one opportunity that we haven't addressed is medical tourism. And Dr. Tarang, let's get into that. I mean, what are we talking about? How large is this potentially an opportunity for us to be able to exploit?
So I think India right now is absolutely at the best state to put ourselves as healthcare on the global map, and I also feel that there is a tremendous opportunity for medical tourism. Reason is because we have the best skill set across the healthcare, whether it's pharma, whether it's diagnostics, and of course our doctors and our the availability of our staff. So we have that strength. Second strength that India has which is actually a competitive advantage, is the cost. The way we provide healthcare, and that too now I would like to stress upon the fact that the quality healthcare that is available in India at the cost it is available, which makes it more than value for money. It's not prevalent in any of the areas around or whosoever we feel is our competition, but actually if you ask me, there is no competition to India when it comes to healthcare, and the world is realizing it. The third thing is that I think one of the panelists also shared was that we are very open to the fact that we get the best of the technologies in most of our hospital as soon as it is launched. So we get the best of the world in every area. The only thing is, and I think to some extent if we foster medical tourism, probably that can give some answer to how we will fund R&Ds in each of the areas, because if we invite medical tourism, then I think that's the place where we are actually giving the best of ours to also the people who are looking to get the best access to the healthcare. The only thing where I think we need to get little help on that is to the countries outside India. We are not an accessible country for medical tourism. I think this is something which where we actually need the help of our the government.
Ladies and gentlemen, thank you so much for joining us here on this edition of the PwC CNBC-TV18 CEO Dialogue. We are going to take a break and return with more conversation, but from all of us here for the moment, many thanks for watching.